We're ready to start question period. I recognize the Leader of His Majesty's Loyal Opposition.
Good morning. Good morning, Speaker. Good morning, Speaker. My question is to the Premier. Speaker, everything old is new again. Just over 10 years ago, the official opposition discovered that the government had been using code words to cover up misconduct. That was the Liberal government, and they were found to be using the term Project Vapor, Speaker, as code for their gas plant cover-up. Now we know that the current government also used code terms like G-Star and Special Project to cover their tracks on the Greenbelt grab. So my question to the Premier is Special Project G-Star this government's Project Vapor?
Minister of Municipal Affairs and Housing.
Mr. Speaker, I think the Integrity Commissioner has addressed that, and I think I've addressed that on a number of occasions in the House.
The supplementary question.
Okay. Thank you, Speaker. The Integrity Commissioner said Ryan Amato identified Patrick Sackville, who is now the Premier's current Chief of Staff, as the decision-maker in the Premier's office for the Greenbelt, quote, special project. We have emails with special project in the subject line sent between Mr. Amato and Mr. Sackville, and it is clearly the $8 billion Greenbelt scheme. They sent emails with details about the scheme, like removal criteria, Speaker, but they never actually say the words Greenbelt. So my question to the Premier again, I think the people of Ontario would deserve a response from the Premier himself. Did anyone in the Premier's office direct that government officials avoid or destroy any paper trail that could expose their Greenbelt discussions?
Minister of Municipal Affairs and Housing.
Again, Mr. Speaker, I think the Integrity Commissioner has addressed that, as has the Auditor General, and I've answered that question on a number of occasions in the House.
The final supplementary.
I understand why the government doesn't want to address these questions, but the people of Ontario deserve answers. It's a question of integrity. It's a question of accountability. The use of code terms is evidence of intent to conceal. Someone was trying to cover their tracks, and that's not all. The Auditor General found that political staffers were not just deleting emails related to the Greenbelt, they were also using their own personal emails to avoid detection. The Premier himself conducts government business on his personal phone, but refuses to disclose his phone records as required by law. When the Liberal government got caught covering up a scandal during Project Vapor, someone went to jail, and guess what? It was the Premier's Chief of Staff.
Question.
Why is the Premier following the Liberal government down the same path of code words, cover-ups, and criminal investigations?
Members will please take their seats. Minister of Municipal Affairs and Housing.
Thank you, Mr. Speaker. Again, if the Leader of the Opposition has additional information that she would like to share with the Integrity Commissioner, I invite her to do so.
The next question. Once again, the Leader of the Opposition.
Don't worry. That's going to happen. That's going to happen. Speaker, we spend a lot of time in here talking about this government scandals, the Greenbelt grab, the cover-up, G-Star, the RCMP criminal investigation of this government. But one of the biggest scandals in this province is the fact that more than 2.2 million Ontarians don't have a primary care doctor. The health of Ontarians is at risk, and that risk increases with every single passing day that this government fails to deliver. So my question to the Premier is, exactly how long will he keep people waiting for a doctor?
The Deputy Premier and Minister of Health.
Very much, Speaker. You know, I love these questions because it gives me an opportunity to talk about the investments that our government, under Premier Ford, have been able to make in primary care multidisciplinary teams. 78 new or expanded primary care teams, multidisciplinary teams, which means doctors working with nurse practitioners, working with nurses, with dietitians, with mental health workers. It is historic that we have seen this investment. And respectfully, Speaker, the investments are happening across Ontario. 78 different teams in Toronto, in Ottawa, in Orillia. Where we see the need, we have made those investments, a tripling of the investment that we announced under our Your Health plan.
I remind the members to make their comments through the chair. Supplementary question.
To make these issues sound complicated, but healthcare workers have been offering up a simple solution for years, and I really hope that the Premier is listening to this. Doctors say they can take on an additional 2 million patients, 2 million, if someone else could handle the paperwork. You heard that right. We can cut down the primary care wait list by 90%, Speaker, if the government would help get this paperwork off doctors' desks. So my question to the Premier is, why is this Premier letting paperwork stand between doctors and patients?
The Minister of Health.
Thank you, Speaker. You know, we have an ongoing, regular conversation and a committee with the Ontario Medical Association to talk specifically about where there are opportunities for different clinicians to be able to do some of the necessary and needed paperwork that is part of serving our patients. But having said that, we've already made changes. You know, the expanded scope of practice that we have announced and embarked on, particularly in pharmacies. We now have over 800,000 people who are accessing their local community pharmacists to deal with minor ailments. Those are changes that our government has been able to put in working with our partners. We've expanded scope of practice for nurse practitioners. We've expanded scope of practice for RNs. And we continue to do that work because we know people need to be able to see the appropriate clinician depending on the issues and illnesses that they're dealing with. Thank you, Speaker.
And the final supplementary.
Well, Speaker, talk is cheap. Talk is cheap. Minister, doctors are leaving the system faster than anyone can recruit them because of this exact issue. Doctors should be spending their time with patients, not with paperwork. Why does the government continue to complicate this issue? Doctors are spending 19 hours per week on administrative tasks. If they could spend that time with patients instead, it would be like adding 2,000 more doctors. That would reduce the primary care wait list by 90%, Speaker. A practical solution, a simple solution. Why won't the government get the paperwork off doctors' desks?
Members will please take their seats. The Minister of Health.
Where was the member opposite? Where was the party opposite when they were propping up the Liberals and they did nothing to prevent the Liberal government at the time to cut 50 residency positions in the province of Ontario? Imagine, Speaker, how many more physicians we would have practicing in the province of Ontario if the Liberal government hadn't cut those 50 positions. Speaker, numbers matter. It would have been over 200 new physicians in the province of Ontario. We are actively working with our partners like the College of Physicians and Surgeons of Ontario. A single ministerial directive letter ensured that internationally educated graduates who are waiting and want to practice in the province of Ontario have that opportunity. The direction was quickly assess, review, and when appropriate, license people who are waiting to practice in the province of Ontario. We'll continue to get the work done. Thank you.
Thank you.